Next, let's talk about when to consult neurologist or neurogastroenterologist. You may want to see a neurologist or neurogastroenterologist if you have GI symptoms that suggest a neurological cause, such as dysmotility or neuropathy. For that, we are going to talk about three different tests. And number 33 is AGID, autonomic gastrointestinal dysmotility testing. 34, neuropathy examination and the nerve conduction studies. And 35, intestinal neuronal dysplasia diagnosis. So let's start with AGID, autonomic gastrointestinal dysmotility test. So if you have symptoms of this motility that suggest autonomic nervous system involvement, then you should go and get this test in consultation with neurologist or neurogastroenterologist. So the purpose of this test is to assess disorders affecting autonomous nervous control of the GI tract, because autonomic gastrointestinal dysmotility involves function of autonomic nerves that control GI motility. So it will contain various tests, including autonomic function test and gastric emptying test. For this, the specific preparation will depend on the individual test, and the test may include heart rate variability, blood pressure monitoring, and gastric emptying studies. And the analysis will be how well the autonomic nervous system is functioning. And if the normal result comes out, which is normal autonomic functions and gastric emptying times, then perhaps we can rule out the neurological reasons. But if the dysmotility is confirmed, treatments like dietary changes and medications may be recommended. And this is just a suggestion, and your gastroenterologist and gastroenterologist and the neurologist may be able to get you the personalized treatment plan. The next, let's talk about neuropathy examination and nerve conduction studies. So when to do this test and examination. So if you have symptoms of neuropathy, which is the symptoms are numbness, tingling, or muscle weakness affecting the GI tract, the purpose of this examination and this studies is to detect autonomic and enteric neuropathy impairing bowel motility, because neuropathy can affect the nerves controlling bowel movements, which can lead to motility issues. Therefore, nerve condition studies and electromyography to assess the nerve function will be conducted. For this, no specific preparation is required. The procedure will look like electrodes are placed on the skin to measure the nerve and muscle functions, and the analysis will be done to check for abnormal nerve signals which indicate neuropathy. And obviously, normal results is the normal nerve function. And there will be a mild discomfort from electrode placement and nerve stimulation. And if the abnormal nerve signals are detected, then further tests or treatments like medication and physical therapy may be recommended. And the final test we are going to talk about for neurology is intestinal neuronal dysplasia diagnosis. So if you have severe motility disorders not explained by other tests, so purpose is to diagnose this rare condition affecting intestinal nerves leading to serious or severe motility disorders, because intestinal neural dysplasia involves abnormal development of intestinal nerves. For this, biopsy of the intestinal wall is done to examining the nerve cells. For this preparation, fasting may be required before the procedure, and obviously a biopsy is taken during the endoscopy or surgery. And for analysis, the biopsy is examined under a microscope to identify nerve abnormalities. And normal result is that normal cell development in the intestinal wall, and obviously you'll have to feel a discomfort because it related to biopsy procedure, fasting, and preparation, and maybe going to some surgery will involve some discomfort. And if it's confirmed, then further test or treatment like dietary changes and medications may be recommended by your neurologist. And obviously, they can personalize your treatment plan based on biomarkers we talked about, based on how you respond to the treatment plans and your physical conditions. With this, we come to the end of when to consult the cardiologist and when to consult the neurologist or gastroenterologist. That this way we can rule out the neuropathy conditions or neurological conditions that causing GI issues. And obviously, after many tests, you have reached to this stage. I mean, maybe a rare conditions is causing GI issues, and to identify that, please consult your gastroenterologist and neurologist.